beginning statement regarding how to hold the sheet when a person turns underneath of it is simply to, one, don't stand up here too high because their arms are going to turn and smack you. So stand about hip and reach across their body. We don't need to be creating a tent, okay? I'm holding the sheets with my leg right here. I'm also going to turn my body not this way, and I turn my body this way. So if they do smack me, it's not going to be catastrophic. I'm here, my leg is pinning the sheet, so regardless of which way it turns, it's secured. And then here, I just gather and gather, and I hold it taut. I don't have to lift this a bunch. So make sure, also, part of what I missed, it was already doing a good job. If the sheet is too small and it's like this, then I obviously don't want that, right? I'd have to pull the sheet up. It should cover their shoulders and neck. Worst case scenario, turn them into a ghost. And in this environment, when we're practicing, you know, we want to be a little more cautious because when you're in the room by yourself with them, right? As long as you don't have a mirror placed in a silly location. If I stand here and they turn, they know I can't see, right? So we're secure in that situation, but in an open environment, we have to be a bit more cautious. So it actually forces you to be even more cautious than you would maybe have to be in an enclosed room. Regardless, effective draping is your first super safe territory. It's sanitation and draping. Okay, so see, hold taut, and she can turn either way she wants. So it's going to be, I'm going to say turn onto this side, your right side, with your left side up, please. Go ahead. And she did a good job, scooted down the table. So the head is on the table, not on the face cradle. And then if I was checking for one more thing, it would be that she's not too far that way, where I'd have to reach a bunch. I want them at least central to the table, if not a little bit closer to the edge where their back is. That way I'm not reaching. And I just gotta gather and find this lovely blanket. There we go. Work my way around. Now, if we want to be super cautious with the draping here, I take the sheet on this side, I stand strategically, and I just tuck it underneath the head. That'll help keep it more taut across the chest. But another thing I'm going to want is access to the arm. So while I'm moving a person, this all gets more seamless. We'll see it more in real time on the other side. You're going to have to bring your arm back towards me, up over. See how we all can control that together. Her arm's up over top. And then I can tuck in like that. But using some kind of surface covering material for working here in the neck and shoulder area is my easiest hack. You'll see it on the other side a little bit better, but you see with this, I can keep the arm fully covered, work on the back. When we come to the other areas, I can lay it actually more across the neck, and then that will allow me to drape the entire back and even the side of the body without any concern. The other thing I could add in all of this would be the pillow. Do you want that underneath?
I have it up front.
You have it up front?
Yeah.
Okay, cool. So this, she was already using it as a huggy. So that pillow that was under the abdomen can just stay with the client and be so that they hold across the chest. And that's kind of just a nice comfy anyway, but adds all this coverage and comfort for the front of the body. And our big square bolster is where I'll show my, I guess I won't. I'm gonna go under the sheets just like it shows you in the book. What a concept. When figuring out where this should be, their foot should be on it, not off the edge of it. Okay, now, working here. I can't remember how Sarah was doing it, so we'll have to see her demonstration in the future because her angle for the head worked really well. Your goal here though, just in general, is looking at here, this isn't the best model for it. You have these small muscles on the occipital bone of the skull, okay? Then we have these temporalis muscles here on the side. Those are big, and they're related to jaw action. It's not just these muscles by the jaw, it's these big temporalis muscles. And then they make these really big on this model, but you have muscles on your forehead too. So those are the ones I'm trying to work on. Forehead, temples, occipitals. And then moving the scalp just as much as possible. And there's lots of ways you could stand and orient yourself to pull this off. It's where you can get kind of inventive, like I can work more specifically on the temples with just both hands like that. I can just slowly work my way from kind of on an angle in front of the client to behind the client, and the whole time you're just trying to move the scalp with a little bit more pressure and focus on those three muscles. Okay, and that'll translate into going up into the base of the skull. My order and sequence here sometimes changes, so I have to be mindful of that. I'm going to start with just working our way from the skull down. I'm going to try, I feel like that might work. Now, here, not sure how easy that is for everybody to see. I'm planting my palm like a wedge, similar to like the L versus V formation. If I bring my wrist more into extension, then this part of my palm is going to act like a wedge and be able to get seated into smaller areas. So especially at the base of the skull, if I just keep my hand flat, I'm going to just glide up onto the skull. So if I increase my wrist angle into extension, then my palm will go more between the base of the skull and C1, C2 atlas axis. You're never going to be that deep. If I looked a little bit at the skeleton, I mean, the back of the head back of the neck is packed with muscles. Now, showing more how I actually do this is, like, this would be kind of maybe more this initial superficial warm the area up, but then I'm going to come in and use a forearm, and this is how I predominantly work here. And I know the forearm seems initially kind of scary, but it's a broader basic compression. It's much easier on your body, and as long as you don't, it's always going to be a V formation. I'm standing behind them, and I don't have my arm in that L orientation. That means I'm going to be contacting more the posterior side of the body every time, as long as I'm like this. And even if I go like this, it's not going to be too catastrophic. We just don't want to come over onto this anterior triangle. So, not this, just this. It'll be more comfortable for you anyway, because you're just trying to kind of get everything behind the ear line down to their shoulder, really down to their scapula. And I can just feel with my forearm, there's the base of the skull. I'm not going to push up into the skull. I'm going to use that as a landmark and push a bit more. I'm trying to be between the skull and the neck. So I may change my orientation. Rather than being up on an angle like that, I'm going to change my orientation to be more going across. It's like going from the very back of the neck towards the front. And if I just scoot down a little bit, now I'm not at the base of the skull. I'm just right in the middle of the cervical vertebrae. Same application, starting more posterior and just gliding, or at least in this case, applying a directional force, going more lateral. Cool. Now I'm going to switch my arms and use this. Could be a soft fist. The forearm works better. Now I can kind of glide from the base of the skull and let that guide me. There's not many muscles right here. The muscles are here, adjacent to the neck. So if I just lightly glide, starting at the base of the skull, down to where those upper traps are, There's some other muscles there too. And when you see me doing this, I'm just kind of searching around, like I can feel C7. I'm like, okay, I don't want to push on that. I'm gonna be a little bit more over here. Okay, where's my feet? I'm not really lined up. But I'm able to do that and make it feel like it's just part of this rocking action. All these adjustments are me finding bony landmarks, so I'm not pushing on something I don't want to, and adjusting my body so that I'm more comfortable. Like, okay, there. Then pressure till it's just right.
Good.
Okay. Now, anywhere here, neck and shoulder, you want the extra thing to do, just start with breathing. I find a nice tight spot in those upper traps, levator scap. Levator scapula is another muscle just underneath the upper traps. A lot of times when you're working there, especially that thumb action, where you're finding something kind of rolly and knotty, it's not just upper trapezius. It's also levator scapula. But just take big deep breaths. And ideally a person doesn't use their shoulders too much while they're breathing. So this works really good in that I'm applying force to those muscles, telling them shush, don't fire, don't shorten, related to breathing. They'll always fire a little bit, but they shouldn't be dominant here. Muscle energy techniques, which are like the fancy things shown for how to like fix and change muscles, make them shorter or longer or stronger or whatever, are going to be about you applying a compressive force and then having them activate the muscle in some kind of orientation, usually shortening it first. So even breathing can be used as a way to compress a muscle, and when they breathe and they inhale, some muscles are shortening. When they exhale, those muscles will be lengthening. Okay, and I gotta find that arm again. I'm gonna steal your arm. Here we go. Here's one option. We're gonna work on the lateral side of the torso. The important muscle there is latissimus dorsi, or the lats. And then there's another one called serratus anterior. Latissimus dorsi moves your shoulder joint. It's about a deduction when it shortens. Serratus anterior moves the scapula. It's the one that protracts, that weird one that makes you like reach longer, kind of like a push-up action. The two like to get stuck together, and then there's a problem. So I know this orientation and this being able to apply force here is just going to be a little bit clumsy because you're navigating the ribs, the shoulder, and the scapula. But it is a really important spot. And worst case scenario, since you learned how to do this over clothing, you can do this over the sheet. If the draping of this is something you're worried about, don't skip the area, just go over the sheet. And then controlling this arm is the other thing that gets people. I can hold it like this. I can let it just drop down on top of my arm. This hand then, let it sit right on top of where that shoulder joint is. You should feel that bony plateau. That's actually part of your scapula. And then the two together, I'm not gonna be forcing any kind of glide. I'm just gonna roll that whole shoulder girdle around. My forearm is helping move the scapula predominantly on one side, and this hand is stabilizing the shoulder joint, keeping their arm from flopping around. And it's also helping move the scapula. But I'm not trying to force this to happen here with my arm. This can stay pretty much planted in a static compression, and if a glide happens on its own, great. My other trick is your hands here. Don't turn your hand over. Just let your hand stay like this, kind of pronated. Let your hand come up into extension, and right there in the pad of your thumb. And then I have control of their arm, and I can do all this mobility stuff and not worry about their arm. Maybe, I don't think it bothers anybody that's grazing across the front, but there's a little bit more control of where their arm is in this. And then same thing, I can just hold everything down. I'm applying pressure on the ribs. I'm holding the scapula down, and big, nice breaths. Breath in, big breath out.
I think you need to log in and report your life changes.
Oh, okay.
Okay, I'll set this here for you.
Big breath. And good. And just that's most of what needs to be done here. Doesn't need to be more technical than that, even when we get to like all the fancy stuff with massage, all right? But it's an important area that just does not get worked on. Okay. We'll further figure out ways to work on the actual back if we were limited only in Sidelying, but that'll be in the future. Right here though, is an excellent place to work on the low back, recognizing how much stuff is back there. This model is not going to do a great job, but it's just that we have muscles that follow the spine, and then we have muscles that come over, attach on the top of the pelvis, as well as all your abdominal muscles, well, 3 of your abdominal muscles. So this is also a place where you can usually get a lot more pressure. The one thing that might get you is if the table is too high, this is difficult. So either you need that step stool to make it a little bit taller for this spot and for the hip, or with the adjustable table, I lower the table. And it's just the right height for me, so it should be just fine. I'm gonna come down real lateral. I'm trying to visualize the seam, like on the side of the clothing. And I'm gonna try to push it straight down. I find the top of the pelvis, and I'm just gonna try to cut her right in half. Pressure.
Good.
And same thing here. I know these muscles attach onto the ribs, so breathing. Big, nice deep breaths. From a relaxation standpoint, as well as a stress management standpoint, both of those are like your first starting outcomes. Is the client coming for relaxation? Are they coming for stress management? The other 2 we'll cover in the future is pain management and mobility. But if you are breathing bad, you're going to have a tendency towards more stress. Thereby, you're going to have more difficulty becoming relaxed. So I kind of merge the principles of relaxation and stress management. Relaxation would also include just trying to have sensations that predominantly feel good. The pressure should be just right, not too much, not too little. Focusing on areas the person enjoys, like do they like scalp, neck and shoulders versus hands and feet? Hands and feet have a lot more sensory input as well as the head. So I kind of build a blueprint into these ideas that if I want to achieve relaxation and make sure I work on hands and feet a few times through the session. I want to achieve something that's more related to stress reduction. I make sure I think about breathing. In all honesty, I always do both. Like the breathing and the least a couple of times working on the feet and 1 time working on hands is always part of the routine. So, all right, for the low back, this is a way to work on more of the abdominal muscles. A specific one is the deep one called quadratus lumborum. But if I step a little bit further back and change my arm orientation to that V formation, I can get to all those posterior back muscles. So I can get to the lumbar erector spinae, which go down to the SI joint. So if somebody has a lumbar disc something, if they have an SI joint something, the only difference between those 2 is I come back, more of a V formation, and I'm either going to keep my arm like this to be right in the lumbar spine area. If I tilt my arm a little bit more like this, my elbow is going to go more towards the SI joint. So I'm able to just do between 3 key placements, straight down, cover a bunch of low back muscles, come further back, cover more, tilt my arm in a little bit, cover the rest. And then in real time, I could even just check in with the person, which one of these feels more like your low back issue. And you're gonna get way better angles and more pressure here than you are anywhere else. This is also where last week I sprinkled in the first true muscle energy technique, just because it's so easy and safe. The bottom leg, the one on the table, if a person just starts to lift that up off the table, I do that for us, just tiny, doesn't even have to be that big, real subtle. These muscles on the medial side of the knee and these muscles on the lateral side of the hip and torso. So those are abductors, adductors. Abductors, lateral flexors, adductors, all functioning on the frontal plane. They co-contract related to balance. So you can think about flexors and extensors as your mover walking muscles, and your abductors, adductors as your balance muscles. And then your deeper muscles, your rotators, as your stability muscles. And that's a very, very glossed over assumption. But somebody comes in and I'm like, what's your problem? Is it that you are walking strange? Is your problem posture? Is your problem balance? Is the problem stability? And there's always going to be some kind of, element that overlaps between all of those. But anywhere on these low back muscles, if I have her just start to lift that bottom leg, you might be able to see my arm lift a little bit. Those muscles all shorten, they co-contract with those adductors of the opposite side thigh. So I can be right here, I can be back here, she can lift. It's all gonna work for me. And relax. And these usually should be held a little bit longer. If I was really finding something and trying to treat it, it would be, okay, slowly lift your leg real small. Okay, hold it. 1, 2, 3, 4, 5. All the textbook stuff, all the research says more like 10 seconds. Rarely do people have the patience for that. 10 seconds is where the research says it should get to. Okay. There's the low back. Now here's the hip. Another way to work on the hip area, especially these more lateral ones. So there's the greater trochanter. I need to be just superior to it. Here's the top of the ilia. That's the top of the pelvis. I have all that space in between. So kind of just behind where the pocket on clothing is. That's where I want to be. And I can go a little bit further forward, a little bit further back. Anybody with hip problems, you'll find a bunch of stuff. There'll be all kinds of trigger pointy, knotty somethings here. It doesn't matter what it is. It could be repetitive overuse, like a runner. It could be osteoarthritis. Both of these angles, though, for working on the low back and the hip, as I am applying pressure here, I'm able to get really good leverage and pressure without actually moving the hip. So even if it was really bad osteoarthritis, super safe. If there's a low back issue, like a herniated disc, or somebody has spinal fusion with a cage or something like that, my pressure isn't directly on the spine, especially pushing it into extension, and the action they're doing is using the opposite leg. It's super safe. And I promise you that, like my dad had a really bad car accident, crushed 2 vertebrae, had a huge cage in there, they had to put it in twice, and that was the only way that could be worked on effectively and safely. So, if that works, then it works for the person with mild sciatica. And the greater chance you have of a person being uncomfortable with low back issues, they're laying on their back, no pillow, you push, and you're pushing them more into extension. So, side lying, squash, opposite leg, you're there. Okay, now we're on the other, over to the leg. Bunch, bunch, bunch. Now we can just bend that knee a little bit, gives us a little slack in those hamstrings, and I could hold on to that like a handle and use soft fist again. And I'm gonna be able to just work. Now, remember how I mentioned in prone, I was thinking more of that lateral posterior aspect. Now it's the medial posterior aspect. This is how I can get all those hamstrings. I'm just showing how I could incorporate lots of joint movement. I could just hold it like this and use the same thing with my forearm. Now I come a bit more further medial, more on top. Now I'm going to be on all those adductor muscles. Light pressure to start, then deeper pressure. Okay, then switch. Now I'm going to stand closer to the hip. I can work my way down the lower leg. You could just as easily have kept using the same forearm and just keep working up like that. I think more often than not, that's what I actually do, is I just use the same forearm and work my way down the leg this way. That'll correlate more when we're talking more about fluid movement stuff. For like lymph drain, most of the directions for lymph drain and for venous blood return, most of the directions of application should be towards the torso. That's the only principle they're usually working off of. So if I try to pick a direction, that ends up being the one I use a little bit more, is if I'm pushing things back towards the heart. Okay. Foot, just cradle the top of the foot. Can't miss it. Forearm fits just perfectly into the arch of the foot like a pocket. If I had to, I could drop down on a knee, get in a step. All that. Soft fist works okay too, but I tend to really stress trying to use that form as much as possible, obviously. All right. Over. Now here's a good example of where draping can go bad, is if we make this too taut, then there's just, drafts on either side, right? So all we have to do there is just make sure the sheet is contacting both sides of that leg. Bunch, bunch. And I'm good to go. Even if that foot has to be undraped, oh well. Works just fine. Then here is where I learned a good thing last week, was like we can grab just behind the knee, up on the hamstrings with our push hand. Use this forearm, works really good for like the lateral quads. If you come more straight down on the lateral side of the leg, gotcha, sorry. You're gonna get that IT band, and it's a little bit ouchy. Be careful here. I pretty much never work directly on there. And you saw as soon as I even did, it caused a little flinch. So more on the edges of the IT band more than directly down on top of it. Unless a person's a glutton for punishment and they want that deep pressure, then sure. And Sarah had shown this is a great place to just incorporate a big pull. So if you watch my mechanics, I'm not gonna have this, I'm gonna have this knee straight now. I can just grab those hamstrings on the other side and just pull across like that. And we're done. That's an area that in my routine, I skip. You have to know how to work on it good in this position so you have a choice of what works best for you. But it's one that I am able to work on those areas much more effectively for me in prone and supine. Now this area works great for this push and pull. You can really get just about every single muscle of the lower leg. So just kind of showing the body mechanics of that. That hand is really, on this whole side, more anterior, and this hand's wrapping all the way around as much as possible. Make these big and slow. Okay, forearm. The V formation is going to get more anterior. You're flattening it out, and the L formation is going to get more lateral. There's two separate groups of muscles here. These anterior ones are about dorsiflexion and toe extension. The ones on the side are about eversion. So that's where I got a lot of extra benefit for people, is by mobilizing the ankle and foot relative to all those muscles of the lower leg. It's not that complicated, but I tell you what, it produces a lot better results than if you don't do it. So foot hug, fingers underneath the arch, and on top. Here we go. Okay. And then we'll be going over to the other side.